Hello, my name is Laurie Thomas, and I'm the Vice President of Strategic Development for Consonus Healthcare. Today I want to talk about some of the dramatic changes that are occurring in our post-acute environment and to discuss a tool that we believe can be part of the solution to you surviving these changes. We all know that we're living in a very challenging time in our post-acute environment. There are so many uncertainties surrounding the reimbursement changes, everything from pay-for-performance measures, bundled payment initiatives, ACOs, and the like. In many markets, we're seeing referral sources narrowing their network to a smaller number of providers using certain criteria. We're also seeing payers using data to make reimbursement decisions that just don't make sense for the patients we serve. So how does this impact you? The increased complexity and focus on data is impacting providers in a couple different ways. First of all, many providers are seeing a decline in their skilled census. This is a result of narrowing the networks from the referral sources, and also payers determining a shorter length of stay for each episode. Secondly, the increased use of data to determine reimbursement decisions is often based on inaccurate data or outdated data, resulting in a negative consequence for the provider. As a provider, what do you need to know? First of all, it's critical that you understand your referral networks and payers and the criteria and data that they're using to make their referral and reimbursement decisions. And most importantly, it's imperative that you understand your own data. Where does it come from? Is it current information? Is it accurate information? Don't rely on others to provide your data for you, or they'll determine your future. Fortunately, we have a solution, and today I'd like to tell you about CoPilot. CoPilot is a data analytic tool that pulls live information from your electronic health record. It gives you the ability to report on things like hospital readmissions, functional outcomes, quality measures, and more. CoPilot is agnostic, and by that I mean that it has the ability to pull from any electronic health record, and it avoids duplicate data entry and the need to purchase additional software. CoPilot gives you the ability to filter the data in several different ways. For example, by referral source, by payer type, by diagnostic group. This gives you the ability to produce a report that gives you meaningful data where you can take specific action and tell your own story. For example, when you're going to meet with one of your referral sources or a payer, you're going to want to have real-time information that's customized for your audience, not months-old claims data, which is typically what most of these groups use. While we do have historic CMS data for market comparison purposes, CoPilot uses real-time information that's pulled every hour on the hour. And this is what makes CoPilot so unique. If you'd like to see CoPilot in action, we would love to show it to you. If you're facing some of the challenges of narrowing networks, declining census, reduced reimbursement, or you just want to be prepared for the future of healthcare, we'd love to show you how CoPilot can be part of that solution. At Consonus, we'd like to think that we're your partner in action. We can use CoPilot to help leverage your data and help you report on measures that demonstrate your value. This results in better payer and referral source relationships and a better market share in your community.